Following an accident, the common peroneal nerve was damaged at the lateral aspect of head of fibula in a young girl. This can result in all of the following except: head of the fibula is the usual site of injury to the common peroneal nerve because the common peroneal nerve winds around the neck of the fibula just deep to the skin. It is subcutaneous at that site. Therefore, a penetrating injury along the lateral aspect of the knee can easily damage the common peroneal nerve. Also, fracture of the neck of the fibula can damage the common peroneal nerve. And in India, one yoga exercise also can damage the common peroneal nerve. There is one yoga posture where the entire lower limb is lifted up and kept behind the shoulder like this, and the person will be standing on one foot. When you do this exercise all of a sudden without any prior proper practice and training, the common peroneal nerve is unduly stretched, and when the person releases this posture, the person won't be able to lift the foot. It will result in foot drop. So let us see the origin, cause and the distribution of the common peroneal nerve in the subsequent diagrams to find out the right response for this question. Before that, we shall discuss this question also, and we will see the answers for both after seeing the diagrams. Which of the following movements tests the integrity of the deep peroneal nerve? We have seen this now already in the anterior compartment of leg. And this is the nerve of the anterior compartment of leg, therefore it innervates all muscles in this compartment. And which movements test the integrity of the deep peroneal nerve? Plantar flexion of the foot, inversion of the foot, eversion of the foot, extension of the great toe. We will find out the answer after seeing the diagrams now. Lateral compartment of leg, we will see the two muscles in this compartment. Tibial, the peroneus longus and brevis are supplied by which nerve? We have already discussed the common peroneal nerve divides into superficial peroneal and deep peroneal nerves after winding around the neck of the fibula. The deep peroneal nerve enters the anterior compartment of leg, and the superficial peroneal nerve enters the lateral compartment of leg. Therefore, now we know it is the superficial peroneal nerve that has to innervate the two muscles in the lateral compartment. We shall see the diagram now. Look at this. This is the common peroneal nerve which is in the popliteal fossa. It runs downwards and reaches the head of the fibula. Then it winds around the neck of the fibula, which is a common site of injury to the common peroneal nerve. After winding around the neck of the fibula, the nerve divides into two branches. This one enters the anterior compartment of leg, deep peroneal nerve. The other branch enters the lateral compartment of leg, superficial peroneal nerve, are the two terminal branches of common peroneal nerve. This diagram is again to show you the common peroneal nerve and its branches. Here is this nerve winding around the neck of the fibula, dividing into two branches. This is the deep peroneal nerve entering the anterior compartment of leg. Why is this nerve called a deep peroneal nerve? Because it runs deep to all muscles in this compartment. It runs down deep to the muscles in this compartment, reaches the dorsum of the foot and becomes subcutaneous only in the lower part of the foot. to innervate the skin over the first interdigital cleft. So this is the only region where this nerve becomes superficial to innervate the skin. Rest of the course of this nerve in the anterior compartment of leg is deep to the muscles, hence the term deep peroneal nerve. The other branch is the superficial peroneal nerve. It runs superficially in the lateral compartment or peroneal compartment of leg, supplying both muscles in the compartment and also skin over the compartment. We will see. This is the peroneus longus muscle. This is the peroneus brevis muscle. And you see that superficial peroneal nerve giving branches to these two muscles. In addition, since it runs superficially in this compartment, it innervates the skin over the lateral compartment of leg. That means skin over the anterolateral aspect of the leg and most of the dorsum of the foot. You can see those branches to the lateral aspect of the leg and most of the dorsum of the foot because of its superficial position. These are the two branches of the common peroneal. So one thing you should understand, common peroneal nerve as such does not innervate any muscle. It gives only some cutaneous branches when it is in the popliteal fossa and also some articular branches to the knee joint. And it leaves the popliteal fossa, then it divides into superficial and deep peroneal nerves. They actually innervate the muscles in their respective compartments and also skin over the dorsum of the foot. Okay, we will see the details. Cutaneous distribution of common peroneal nerve and its branches. This much part of our leg is directly innervated by common peroneal nerve through a cutaneous branch. That is called lateral cutaneous nerve of calf. And the anterolateral aspect of the leg and most of the dorsum of the foot are innervated by superficial peroneal nerve. The lateral border of the foot is innervated by peroneal communicating. It's a branch of common peroneal. This peroneal communicating nerve joins the sural nerve, which is a branch of the tibial, which I will show you later. Through the sural nerve, the peroneal communicating nerve innervates the lateral border of the foot. The first skin over the first interdigital cleft is innervated by deep peroneal nerve. The medial border of the foot is innervated by which nerve? Do you remember? We have seen this nerve right from the root of the thigh, the longest cutaneous nerve arising from the femoral nerve. We have seen this nerve passing through the adductor canal, then descending along the medial aspect of the knee, then running further down to reach the medial border of the foot. Saphenous nerve. Saphenous nerve. We will see some more details. This is the tendon of extensor hallucis longus. This is the muscle responsible for extending the big toe. Being a muscle of the anterior compartment of the leg, it is supplied by deep peroneal nerve. Clear? So, how will you test the integrity of the deep peroneal nerve? Ask the patient to extend the big toe. Only when the extensor hallucis longus tendon is intact, this is possible. That clearly shows that the deep peroneal nerve is intact in that individual. At least the branch supplying the extensor hallucis longus is intact. Yes, we will discuss this. In this girl, the common peroneal nerve is damaged along the lateral aspect of the head of the fibula. All these things are going to be the findings. Weakness of ankle dorsiflexion. Yes, muscles in the anterior compartment will be paralyzed. Therefore, there will be weakness of ankle dorsiflexion. That can lead to foot drop. Foot drop means the person won't be able to elevate the foot, dorsiflex the foot. Therefore, it will be kept in plantar flexion like this. This is called foot drop. That also will be a finding. And sensory impairment on the lateral aspect of the leg extending to the dorsum of the foot. Of course, that much part of our leg and dorsum of the foot are innervated by the branches of common peroneal nerve. both superficial and deep peroneal nerve. So that also will be a finding. But loss of angle jerk. What is angle jerk? If we gently tap the tendocalcaneus behind the ankle, what happens to the foot? It is plantar flexed due to contraction of the gastrocnemius and soleus. Gastrocnemius and soleus are the muscles of the calf. They form the bulk of the calf and they fuse to form a common tendon called tendocalcaneus, the strongest tendon in our body. It is inserted into the calcaneus. What is the action of these two muscles? They produce plantar flexion because they are the muscles in the posterior compartment of leg. And when we gently tap the tendocalcaneus with our knee hammer, the foot is plantar flexed. So this angle reflex tests the integrity of tibial nerve, which supplies the muscles in the posterior compartment, not for the common peroneal nerve. Therefore, angle reflex will be intact in common peroneal nerve injury. Loss of angle reflex indicates injury to the tibial nerve or weakness of the gastrocnemius and soleus muscles forming the tendocalcaneus. This is the right response for the question. Let us discuss question number 24. Which of the following movements test the integrity of the deep peroneal nerve? We have seen already. Extension of the great toe is because of the contraction of extensor hallucis longus muscle. It is a muscle in the anterior compartment of leg and therefore it is applied by the deep peroneal nerve. So a specific test for testing the deep peroneal nerve is extension of the big toe produced by extensor hallucis longus and also brevis, which is also supplied by the deep peroneal nerve. Question number 25. The peroneus longus and brevis are the muscles in the lateral compartment of leg. The nerve of the lateral compartment of leg is the superficial peroneal nerve. This nerve supplies both the muscles. Therefore, number 2 is the right response for the question.